Good morning. My name is Ryan Solomon. I'd like to introduce to you the newest technique/tool that EMS personnel are utilizing for endotracheal intubations. For those of you who are unaware of what endotracheal intubations are, I'd like to first explain exactly what it is and when and why EMS personnel utilize this process. Then I'd like to go ahead and explain the process of intubation with the utilization of a new tool that we have for EMS personnel, which is called the gum elastic bougie, which I'll get into later. First off, endotracheal intubation is a process in which a tube, such as this is an endotracheal tube, is placed into the trachea of an individual who is either not breathing or isn't breathing adequately enough to maintain proper oxygenation saturation. Also, we tend to utilize tracheal intubation to make sure that someone's airway is protected, such as so they're not conscious, they could have fluids that are falling into their airway, causing them to go into their lungs and possible aspiration, which can be very deadly. So that's another reason why personnel utilize the intubation process and place an endotracheal tube. When EMS personnel do decide to move forward with endotracheal intubation, he or she needs to properly pre-oxygenate the patient via a bag valve mask. For those of you who are unaware what a bag valve mask is, this is a bag valve mask. It's a piece of equipment that EMS personnel utilize to basically force oxygen into the patient's body through their nose and mouth, which allows them to inflate their proper chest rise and fall and provide for proper oxygenation of the patient. This is also a key tool during the intubation process. So this is what a bag valve mask is. Once this is completed, the provider will begin the intubation process, which includes pre-medications. They'll start an IV on the patient, and they'll give them medications such as etomidate, ketamine, Versed. These are just types of drugs that we give to sedate our patients to allow the intubation process to be successful. Once the patient is properly sedated, we move into the actual process of intubating. This is where the bougie comes into play. Prior to the bougie, EMS providers had to visually locate the vocal cords by utilizing only landmark, which is taught in paramedic school. This proved many times over and over to not always be successful due to not being able to always visualize the vocal cords, whether the patient's anatomy is causing it to be unable to visualize the vocal cords, and or there could be secretions or fluids or blood or something that's going to inhibit you to actually visualize the vocal cords. The bougie, on the other hand, enables the provider to not only visualize their landmarks, but give them the ability to feel their way into the correct position. The bougie can be utilized in two ways. It can be direct visualization when you don't have those things such as anatomy issues, secretions, blood, and things of that nature. Then you can use your visual approach and just place this directly into the vocal cords. Then what you would do is once you have that in place through the vocal cords, you would place the endotracheal tube over the bougie and slide it correctly into place, which would go right into the trachea, and you would secure your intubation. Now also, when you have those things such as blood and secretions and things of that nature, this new tool allows you to not only place it correctly and have the feeling of it placing correctly. When you place the bougie into the patient's mouth and possibly through the trachea, if you actually have it in place properly, you should be able to go back and forth, and you will be able to feel the cricothyroid rings. They're rings that you can feel in your throat. If you take your hand and you can feel your throat, you feel little rings. That's what you will feel on this, which will tell you that you are a correct placement, and that would allow you to continue on with the process and move forward with the intubation. Also, if you do have correct placement, you will be able to progressively advance the bougie down into the patient's trachea, and you will meet resistance. That's called hitting the carina. It's where your lungs branch off from your trachea into the left and right. There's a split, so you'll meet resistance. If the bougie's not placed properly, what will happen is you'll actually go down to the patient's esophagus, and there's no stopping it. This thing will actually, you can place this all the way down, and it'll keep on going and won't stop. That's when you know that you have an esophageal placement and you're not in the correct place. This tool is an amazing tool for that particular purpose. It can show us exactly, it's not maybe 100% if you're not, but it will tell you 100% whether you're in the right place or not. So that's how you utilize the bougie. This is how important this particular type of tool is for the EMS personnel. I'd like to thank each and every one of you for taking the time to listen to this short, informative lesson on intubation while utilizing a gum elastic bougie. I hope you have a better understanding of what EMS providers go through to accomplish such a life-saving intervention. And thank you very much.